Come in.
Hi there. My name is Greg. I'm a PA student here from UTRGV. Mrs. Billings, is it best if I call you Ms. Billings?
Yeah, sure.
All right. So what we're going to do today is I'm just going to ask a few questions. I'm going to be working in conjunction with your physician. So anything that I say, we'll be working with your medical team to be able to help you.
Okay.
So is it all right if I ask you a few questions?
Sure, go ahead.
Perfect. So first off, what's going on? What brings you in today?
I'm having a little pain in the lower abdominal area.
Okay.
It's kind of off and on. Pain goes off and on. It's more of a sharper pain.
So you'd say it's in this region here?
Yeah, it's like in the lower right.
Okay. Could you describe it for me? What's going on with that?
It started with when I started up exercise. It's more. It hurts when I sneeze or cough or have any kind of movement that uses that muscle in the lower right area.
So when you're sneezing or exercise?
Yeah, I usually have to kind of press on it to kind of, right,
okay.
to help it.
To ease the pain or?
To ease the pain.
Okay. Have you ever been diagnosed with anything in the past?
No.
Nothing in the past?
No, this is the first.
Okay, and about when did this start?
Probably like a week ago.
About a week ago?
Yeah, about a week ago.
And since about a week ago, has it been getting worse? Has it been?
I'd say it's gradually gotten worse.
Okay. And on a scale from 0 to 10, 0 being it doesn't hurt at all, and 10 being it's the worst pain you've ever felt in your life.
I'd say it's about a 2. It's not like I'm going to die anytime soon, but yeah, it's about a 2 or a 3.
Okay. And can you describe the pain for me? What does it feel like?
What does it feel like? It's like I said, maybe when I cough or when I sneeze, that muscle maybe knots up or tenses up, and it's a sharper pain than anything. Okay. It's not any numbing. It's not anything like that. It's more of a sharp muscle spasm, maybe as a.
Okay, so it feels like a cramp, or it's just like a sharp pain.
It's like a cramp, I guess. More, yeah. It's more cramping than anything.
Okay. Okay. And about how frequently is it? Is it only when you're coughing and only when you're exercising, or do you feel it throughout the day?
It kind of goes off and on. More when I do exercise because you're using that muscle, but I mean, if I'm just sitting here, I'm okay.
Okay.
You know, but if I'm maybe moving more, I guess I would feel it more.
So it's more when you're active.
Yeah. Yeah.
Okay. And do you feel like it radiates anywhere? Does it go anywhere else, or is it?
No, it's really that one spot.
Okay, so it's just right there.
Mm-hmm.
Okay. And do you have any? Do you remember where you were when you first felt it, or what happened? Was there something that happened that started it?
Probably when I was trying to get out of bed. So you like using that abdominal muscle to get out of bed, and I shift a lot in bed too throughout the night, and so shifting uses that muscle, and I have to kind of fold my knee in to suppress it in order for me to shift in bed, if that makes sense. So I first started noticing when I shift a lot of bed.
So it was when you got out of bed, or you were in bed, or
during the night. So in bed when I'm laying down, trying to use that side of my muscle.
Okay. And did it wake you up at all, or was this?
No.
No?
No, it didn't wake me up, but I could tell when waking up in the morning when I would shift to get out of bed, it's that cramping feeling.
So you first noticed it when you were getting out of bed, and this was about a week ago. Okay. Is there anything that makes it worse other than exercise, or anything you've noticed?
No, not really.
Is there anything that makes it better? Have you tried anything?
I've tried some ibuprofen, but I mean, that hasn't really helped alleviate any pain, so I kind of stopped taking ibuprofen.
And about how much ibuprofen have you been taking?
I took 2 the first hour, and then probably another 2, 4 hours later.
Do you know the dosage on that?
Is it 200 milligrams?
So about 400 milligrams
Right.
each time?
Mm-hmm.
And are you currently taking any medications other than the ibuprofen?
No.
Okay. Do you take anything over the counter? Anything?
No, I should be taking vitamins, but no, I haven't.
No vitamins?
Mm-hmm.
Have you taken anything maybe from the pharmacy section? Or herbal remedies, perhaps?
I mean, my usual herbal teas, but I rarely drink that even. But yeah, it's nothing out of the ordinary.
Okay. And besides the issue that you've had in your on your side here, have you had anything else that's been concerning you?
No, not really. No.
Okay. So that's the main reason.
Yeah, why I want to come see you and see what's going on.
Okay. Well, so from what I'm understanding is that you have some pain here in your abdominal area, and it's rather sharp. You felt it first about a week ago, and this was when you were getting out of bed, and that's when you first felt it. It's usually worse whenever you're exercising or you're working or doing a lot of work around the house. You have taken ibuprofen, and it helps a little bit.
Yeah, not really.
But not a whole lot?
Not a whole lot.
Okay.
No.
But it's not really going anywhere else. It's pretty localized.
No, it's staying where it's at. Yeah.
Okay. All right. So along with that, I do have a couple other questions I want to ask about your history, about your personal and medical history, so that I can get a better picture, see if there's anything else that might be associated, and then I can also target my treatment towards you. So one thing I want to kind of start with is, do you have any allergies?
Not that I know of.
Any seasonal allergies even?
Yeah, I never know when it comes and goes, and we just moved here to Texas, so there could be a whole nother set of allergies that I don't know about, but seasonal, probably once a year I get that, everyone gets the runny eyes or the teary eyes and everything.
Yeah,
but
I get it too, so I totally hear you. Do you have perhaps any other allergies, maybe to medications or foods that you're aware of?
Allergies,
No, nothing? Okay, perfect. And you said you're not taking any other medications other than the ibuprofen. Okay. Do you know of any perhaps illnesses that you were diagnosed as a child? Anything in your past?
Other than my 3 C-sections, no other diagnosis, but I've had, I guess, abdominal surgeries.
Okay. So you had 3 C-sections? Does that mean, how many times were you pregnant?
4 times.
So you were pregnant 4 times, and 3 sections. And how many children do you have that are living?
3.
3. Okay. So you lost one of those?
Yes, back in August. So it's been a year.
Okay.
Yeah.
How are you feeling with that?
Actually pretty good considering the situation and the moment that we had, but doing pretty good.
Are you planning on having any more in the future, or?
Life is a little busy right now, so we're taking a pause. We think we're done. We'll see. Okay. We'll see how it goes.
Okay.
Yeah.
Just going with the flow.
Yeah. We're
thinking
about it. But
that's definitely all right. And with your pregnancies, did you have any complications? Anything that you can remember, maybe associated with that?
I mean, the bizarre complication of my first pregnancy. I didn't have any fluid when I was about to deliver, so that was an emergency C-section. And the 2 after that were just scheduled C-section, just for precautions. But complications, is C-section considered complication? Because
I mean, if it's an emergency, you know. But
I was totally fine. I was, no
And you mentioned with your first that you had a complication of low fluid. Could you describe that a little bit more for me? Explain what that was.
Well, so you're supposed to have a normal range of 8, I assume it's centimeters, 8 centimeters to 13 centimeters of fluid around your.
The amniotic fluid around.
Yeah, the fluid around your baby. And when I went in for my ultrasound, my 38-week ultrasound, the ultrasound tech said, "Oh, let me go get the doctor." So she went and got the doctor. They found no fluid.
Wow.
No fluid in me. So
was the baby okay?
They checked the heart rate of me and the baby, and they did all the stats, and they said we were both fine, which is the most bizarre.
Wow.
And the nurse practitioner and the doctor, they said in my 21 years of practicing, they've never seen a level 0 fluid.
Wow.
And I hadn't lost my mucus plug. It was just a range of bizarre.
So all of these things happened, and you were still good.
I was
good.
fine.
The baby
was the baby wasn't upset. We didn't have any other complications. It was just no fluid.
And why was it decided? Were you planning on having a C-section beforehand?
Oh, heavens no! I skipped that part of the book, and I wasn't even. It wasn't even in my mind. They tried to up the fluid with me in the hospital for 3 days straight with IVs and all sorts of stuff, and try to get my body to go into labor. But 3 days and nothing helped. Yeah.
And so they decided.
And so then they decided to perform a C-section.
Wow.
And I bawled my eyes out, but.
Oh, I'm sure.
I wasn't ready for it.
You and your husband was not ready for that.
No, we weren't.
Okay. Other than that, the pregnancies were pretty.
Right. I had great pregnancies. I recovered fairly fast from having C-sections, and I was great.
Wonderful.
Yeah.
That's great. Yeah. Perfect. And are you currently taking any birth control, any medications for birth control?
I have an IUD.
An IUD?
Uh-huh.
Do you know what kind?
Oh, it starts with an L.
An L? Okay.
Oh, Lily.
Okay, we can ask your
my
OB about it. We can get that.
Okay. Yeah. Lily.
So do you know of, okay, so going along with, you said you had C-sections, have you had any other hospitalizations, either recently or in the past?
The most recent would have been the miscarriage a year ago.
Okay.
Where we were on vacation. We were in California, and we were on vacation. And,
no way.
Yeah, and middle of the night, I started bleeding my guts out. So we had our 3 kids, and we were at a hotel, and it was.
That is nuts.
A whole night of bleeding, and so we decided to go to the ER, and I was taken care of there. So.
Oh goodness, I'm so sorry.
That's okay.
You seem like you have such a good attitude about it. But at the same time, I just want to give you a big hug.
Oh,
I'm so sorry.
It was a moment to remember. That's for sure.
Wow.
Yeah.
Wow, you're a tough lady.
Oh, thanks. I try. With 3 kids, I gotta be tough. I gotta be tough. So.
Yeah. Okay. So that was the most recent hospitalizations. Anything else that you can think of?
The one prior to that would have been, well, besides the 3 C-sections, would have been a gallbladder right after my firstborn. But those were, I rarely get sick, and I feel like after turning 30, I just, start breaking down. Everything else stops working, or,
Okay.
Yeah.
So you had your gallbladder removed?
Correct.
Okay.
A month after I had my first child.
Was this voluntary, or what was
the pain and it was just like uncontrollable sharp pains, and we decided to go, and they figured out that it was my gallbladder. So it was removed.
And all right. Now you did say you had the gallbladder removed and all of that.
Mm-hmm.
this pain, has it been around the same time after you had these C-sections, or was there anything associated with that?
No, it really did start about a week or so ago.
Okay.
Yeah.
Okay. Do you know of any perhaps traumas, any accidents, anything that might have happened either around that time or in the past?
No accidents. No trauma. I mean, a lot of stress in my life, but
Okay.
but no trauma or accidents or.
Could you tell me a little bit more about the stress?
Moving, twice in 1 year.
Yeah,
That was
that could do
that was tough. Having 3 kids at home, working, husband working. It's stressful.
Definitely.
And so I don't know if it's really stress induced. I don't know if there's really something going on in there. I can't really. I mean, I could sort of feel a lump in there, but I should probably not Google anything because Google is just awful.
Dr. Google.
but I mean, other than the stress, really, I don't know. Maybe not so fit. I don't know. Maybe the weight of my body is kind of caught. I don't know what.
Okay. I mean, there may be some association with that, but we can take a look and see what's going on. I do have a couple other questions before we wrap up. Do you know if you are caught up on all of your immunizations? Is there anything?
Sure. Yeah. My mom was really good about having all of us immunized. I mean.
And so you've been on the schedule and you got everything that you needed to. And also, you don't know of anything that you had as a child?
Not that I know. No.
Okay. Any illnesses or anything?
Other than common cold, and it was really my siblings who kept getting sick. I was the healthy one.
You were the healthy one.
Mm-hmm. Oh. I was the healthy one.
Okay. And do you usually get your yearly exams?
I do.
You get your pap smear, breast exams.
They come back negative with all.
Okay.
Yeah.
So nothing associated with that?
Nothing abnormal or, yeah.
Okay. I think that's all that I need in that regard, but I do have a couple other questions that I'm going to ask.
Okay. Thank you.
That's it.